Hi friends, Dr. Neeraj Bhatt here. Today we are going to see a video demonstration of bonding a fixed lingual retainer. The materials which we use for this is a flat woven Lione wire, a periodontal probe, an explorer, a pin and ligature cutter and a light wire plier. The first step is cutting the required quantity, the required length of the wire. In this case, we are going to put a fixed lingual retainer from lower 3 to 3. With a light wire plier, we are going to give a proper arch form to the wire. The arch form is ready. We are going to use these all materials to bond our fixed retainer from canine to canine. This is an ortho-solar primer. One drop is enough for this procedure. We are going to use a 3M transpond as our bonding agent and an etchant, and as I already mentioned, a Lione flat woven wire for a retainer. And proper isolation of the field of work is necessary while bonding a fixed lingual retainer. As you can see, we have placed cotton rolls on the labial side and a saliva ejector is continuously in place on the lingual side. All the lingual surfaces of teeth are thoroughly cleaned, and now we are going to etch the lingual surfaces. The position of the lingual retainer on the lower teeth is at the junction of the incisal and middle thirds. We prefer this area as it reduces plaque and tartar accumulation because of its higher position. Now we are going to wash off all the etchant. The saliva ejector is continuously taking out all the water and saliva from the patient's mouth. The patient is instructed not to put his tongue on the lingual surfaces of teeth. Now we'll change the cotton rolls for our next step. The new cotton rolls are in place, and now we are going to air dry the lingual surfaces of the teeth in question, that is from canine to canine region. When we properly air dry the teeth, you get that frosty appearance of the lingual surfaces. Once that is done, we are going to put the primer on the third quadrant canine. Now we will be placing the bonding agent on the canine tooth. Here comes the bonding agent. With an applicator tip, we will place the bonding agent at the right place. Now, this is the retainer wire which we have already given a proper arch form. We'll try and adapt it to the lingual surfaces. A periodontal probe comes in very handy to do this process. We'll check that is the lingual retainer passing through the desired location, that is at the level of junction of incisal and middle 1/3. Once the wire is properly stabilized, we'll use an applicator tip to cover it with the bonding agent. The wire is stabilized properly, and now we'll cure the bonding agent. Now our retention wire is in place and has got primary stability. Now we'll use the periodontal probe to give a proper form to our wire and take it as near to the lingual surfaces as much as possible. A proper adaptation is necessary to take the wire as near to the lingual surfaces as possible to reduce the plaque and tartar accumulation. Then we'll cut the wire so that the wire ends somewhere in the middle portion of the canine on the opposite side. Now the process is the same, that is, we'll apply the primer and now the bonding agent on the contralateral canine. Bonding agent is properly placed, properly spread with the applicator tip or a micro brush. Now again we are going to adapt it properly with the periodontal probe, and we are going to use the tweezer just to bend it and take it more near to the lingual surface. Once that is done, we'll again take our applicator tip or micro brush to take the bonding agent to cover the retention wire. Here it is. We're covering the retention wire with the bonding agent. Now, we'll cure the bonding agent. Now our retention wire is firmly in place as it is fixed on both the canines. Now we'll put primer on all the remaining 4 incisors, all 4 at one go. Then we'll place the bonding agent on all the 4 incisors. The quantity that we take is only minimal that is needed to cover the retention wire. It should not be too bulky Otherwise, it is going to give discomfort to the patient. One more care that is to be taken is, while we adapt the bonding agent, it should not go into the interdental areas. Now, as the bonding agent is adapted, we are going to cure the bonding agent on all the 4 teeth. And this is the final bonded lingual retainer. And this is the final product. I hope you enjoyed this video